Hello, welcome and to this evening to Ken Sanchez Chambers. I call this May 25th, 2023 hybrid meeting of ABCGC plus APS to order. Councilors Benton and Pena are excused. Commissioners Baca, Olivas, and Quesada, Councilor Grau, and Chief of Staff Katrina Sandoval attending as the mayor's designee, along with APS members Danielle Gonzalez and Yolanda Cordova Montoya, are appearing via Zoom. Yay, good to see everybody. We will start with the silent invocation and pledge of allegiance. Please join me in a silent, I pledge of allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Public comment. You will have 2 minutes to share your comments. You'll then be notified when your time is up. For those
Madam Chair, my apologies. If we can go back to the minutes.
Oh, sorry, guys. Thank you, Julie Ann. Approval of minutes, item number 3 on our agenda this evening. I move to approve the March 23rd, 2023 ABCGC plus APS meeting minutes. Can I have a second?
Second.
Thank you, Councilor Feeblecorn. Please call the roll.
Okay, so Madam Chair Barboa,
Yes.
Vice Chair Feeblecorn,
Yes.
Councilor Grout,
Yes.
Commissioner Olivas,
Yes.
Chief of Staff Sandoval.
Yes.
Okay, so called. Thank you.
Thank you, Julianne, and thanks to all that are joining us tonight via Zoom, the participants and presenters. We'll now move on to item number 4, public comment. Folks will have 2 minutes to share your comments and then notified when your time is up. For those participating Zoom, you will be muted and moved to the waiting room. Should any commissioners have follow-up questions to your comment, or commissioners or counselors or school board members have follow-up questions to your comments, we'll have an opportunity to answer. Angela, please let us know how many we've had signed to speak up and call the first name.
Madam Chair, I believe we have one who would like to sign. She did not sign up to speak, but she's here to give comment.
Thank
Madam,
you.
if you want to come to the podium. Yes.
About what it's doing, because it includes a lot of the public governmental officials from city and the county and APS. And I just think that's wonderful. And I read over the minutes for the March meeting, and you guys have a heavy agenda on heavy topics. I would like to get on your agenda, and I don't know how to do that. And if somebody can point me to whomever I would talk to about doing that, I will end my comments.
Thank you. I would love to have an email or conversation with you, and I could, as the chair, I can put you on the agenda, but also any of our members can always suggest.
Okay.
So any of the folks that serve on this board,
Okay.
if you want to reach them and ask them, then
That would be great.
yes.
Thank you very much.
Thank you. Thanks for attending.
And that'll conclude public comment.
Awesome. Thank you. We will now proceed with new business. I am very excited and thankful for the time of our wonderful Senator Jerry Ortiz y Pino. He's joining us by Zoom this tonight, and I'd asked him if he could come help us as the ABCGC plus APS. In our tasks, we are asked to really think through, vet, and know the landscape around behavioral health between our governments. And so I'm excited to welcome Senator Ortiz y Pino to present sort of a state legislative look at our overview. Welcome, Senator.
Well, thank you, Madam Chairman, and it's good to see you all. I'm delighted to be able to talk to you for a few minutes about the last session of the legislature and about what's happening generally in state government regarding behavioral health. Some of it's very concerning, and a lot of it is, encouraging. But I think that we're all working together on it is the most encouraging factor. That the county, the city, and state government and the public school system are all sitting down, trying to pull together and figure out how we deal with what remain some of the most troublesome dilemmas the state faces today: our suicide rate, our alcoholism rate, our drug addiction rate, our serious mental illness rate that winds up being converted to homelessness or even to violence. All of these things are very difficult to deal with. And while they're concerning to all of us, if we could find a way to work on them collaboratively, I do think that that would be a much more effective, likely to succeed approach. And so I jumped at the opportunity to share with you what the state's doing, and then hopefully initiate with you all an ongoing dialogue. We do have presentations during the interim, almost every year during our interim Legislative Health and Human Services Committee meetings from the Bernalillo County Behavioral Health Initiative. And those have been very, very helpful. We just want to keep broadening that input and continue to work on it. Before I talk about some of the specifics, a couple of other general things. It's hard to find behavioral health funding in a single place in the state budget. It's spread throughout the Human Services Department, the Health Department, Children, Youth, and Families Department. A lot of it now is actually in Higher Education Department, where for the last couple of years, major investments in training the manpower that we need in the behavioral health fields have been made. So I've gone through the budget and tried to identify those places where major concentrations of new spending or of expanded program have taken place this year. First thing to comment on is that putting money into the budget doesn't do a whole lot of good if there are no professionals out there to actually carry out the programs. And that's what we keep bumping into in the behavioral health area. That it's all well and good, for example, to put more money into crisis response teams, but if we can't recruit people to staff them, or into detoxification programs, but if there's nobody in Farmington or Gallup who's available to staff them, it hasn't helped us much. So manpower continues to be the single most pressing behavioral health concern that we're focusing our attention on, and we're open to suggestions from you all. During this little presentation, I will cover some of the things that we're trying to do in that regard, but we certainly don't have the problem solved, and we would love to have your input. The last comment I'd make before I start speaking about specifics is a lot of what the state does is going to be focused on underserved rural communities. Over and over again, you're going to hear that term. And I know that if you're in Bernalillo County, it sounds like you're being ignored if we make that the concentration. My own perspective on that is that if we can do something about the rural counties, it's going to have a cascading effect. Bernalillo County will get the benefit of people not coming here because they can get their problems dealt with closer to home, of crime not occurring here because people will not have come here in desperation, and of the manpower situation becoming much more attractive across the board. And Bernalillo County and Albuquerque will get the benefit of that just as much as San Miguel County or Chavez County will. So now, where did we put some new money? This year, I'll talk about the biggest pockets that I've been able to identify from the budget. First of all, as you know, Medicaid is by far the largest finance mechanism that we have for behavioral health in the state. We now have a Medicaid budget. When you factor in the federal 3-to-1, at least in some instances, 9-to-1 match for Medicaid dollars, the money we put up is generating a total Medicaid budget overall in excess of $9 billion. It's a $9 billion program right now statewide. The whole state budget is $9.8 $7 billion. And if you take out the Medicaid share, the state share of Medicaid in that, it's less than what we're spending on Medicaid itself. In other words, the Medicaid budget is bigger than the rest of state government right now in terms of dollars. We've always said education gets 50% of the budget. That's true of the general fund. It's not true of overall spending. So the single biggest expenditure that we added to the behavioral health budget this year was to make sure that the Medicaid reimbursements, the reimbursements to individual providers or to agencies or to hospitals or clinics that are taking care of Medicaid eligible people with Medicaid eligible services, those reimbursements have now been raised above the Medicare rates. They go up to 120% of Medicare for primary care, behavioral health care, maternal and child health services. Those will all now be at least as high as Medicare, 120% of Medicare, higher than, which should make it a much more attractive funding source for doctors and clinics. They won't be as prone to say, well, I'm sorry, I just can't take it. I try to limit my total practice to no more than 20% Medicaid because I just can't pay the bills if I don't do that. That should no longer be an excuse. We should be able to see a lot more of the providers participating in the Medicaid program. That $50 million that we put into that state general fund will generate with our matching money in excess of $230 million of additional Medicaid spending on behavioral health, which should make a big difference. The second big pocket that I wanted to mention is that we put $60 million into what the governor is calling her rural healthcare initiative. $60 million is available to clinics, hospitals, or private practitioners or organizations that want to expand into rural areas. It should be able to cover what it'll primarily be used for is to cover those expenses that an organization might be incurring when they move into a currently underserved area or unserved area until the reimbursement through Medicaid or through insurance starts flowing. So that's the idea behind that. And it actually is 60 million. It can be spent over 3 years. So it may be slow on the uptake this year, but within 3 years, we will have spent 60 million expanding our network of services, primary care, behavioral health, and maternal and child health into parts of the state that are not currently receiving a lot of them. Then we have the opioid settlement money, and you're familiar with what the county got. The county, I think, got, was it 8 million share of the county, of the 90 million the county's got overall in the state? I think they got 9 million in Bernalillo County, 8 or 9 million for opioid programs, or for any drug or alcohol program that you, it's up to you how to spend that money. The state share of that pot was 21 million. And a lot of it is going into medication-assisted treatment in the county health departments. They will now be offering Suboxone and methadone treatment in every county health department in the state, which should make it possible, for example, for people coming out of the county jails or prisons, for that matter, if they're on MAT and need to have some continuity in their treatment, to get it. If there's no private practitioner available who will do it, the county health department will do it now with this additional money. Also, we put $1 million of that money, of those dollars, into the Department of Corrections to make sure that they're offering medication-assisted treatment. They already have a small pilot in Cibola County. We want them to expand it to all their prisons in the next couple of years. They asked to do that in a more gradual basis. So they're starting with an additional $1 million, which should help immensely. When people come out of prison, if they have not had their addiction problems dealt with, they're so much more likely to recidivate, to get back into criminal behavior, and to cause us all lots and lots of problems. Some of that will go to housing assistance for people with opioid assistance disorder. We have that linkages program, and I think that'll be the mechanism they use to expand supportive housing for people with drug problems who get into housing, trying to stabilize their lives. That'll be $2.5 million of that will be used for that purpose. Then there's the higher education department money, and that's the next biggest pocket of money that we put into behavioral health. Almost all of that is going to be devoted to expanding the supply, if you will, of professionals who can deal with these problems. Social workers, psychologists, counselors, psychiatric nurses, psychiatrists, even if we can retain some of the 6 to 8 psychiatrists that are psychiatric residents that are trained at UNM every year, we could keep them in the state, we would have a much more robust system of services around the state. So the first thing is that we appropriated, well, last year we appropriated $50 million for expanding social work education in the state through an endowment fund. Universities applied for money from higher ed to set up an endowment. The interest on the endowment will pay the salaries of faculty. And that's a way for them to add faculty to what they get in direct funding from the state. Three universities got it in that first go round, Highlands, New Mexico State, and Western. I was surprised to find out that Western has actually the largest number of social work students. They have an online program that many of the students in that program are out of state, so we don't get the full benefit of that, but they do train a lot of people on the western part of the state, from Silver City all the way up to Farmington. They'll take courses online through Western and become social workers. Highlands, of course, has their Albuquerque Center in it, and I think they still have their Rio Rancho Center. I'm not sure about that. And they have a program in Las Vegas as well. And then New Mexico State, which had left Albuquerque. They had a program here, they left it. They're just in Las Cruces right now. We're trying to interest them in collaborating with UNM in a program for social worker, master's level graduate social workers at the Health Sciences Center at UNM, so that before UNM can get their social work program off the ground, they could be using NMSU's program as a way to generate more social work students. The second go round this year that was just awarded goes to UNM to help get that program off the ground, and also goes to Eastern, which has a bachelor's level program that they will now expand to a master's level program. So we're hoping that this will, it takes a while, of course, we're priming the pump, but eventually we'll start seeing more graduate social workers getting licensed and available in this state. Similar efforts going on with nursing. Psychiatric nurses have the additional advantage of being able to make prescribing, they can be prescriptive. They can prescribe medications for their patients. And that is a way that clinics who can't necessarily attract a psychiatrist or even a psychologist can get prescriptions for psychiatric drugs prescribed. Then the other thing that there are two other things that we got from, so that was last year. The 50 million was last year. The unspent money was just now spent, so it'll be spent this year. Then we put in $20 million into higher education for a special scholarship and financial aid fund to pay for, while students are taking their graduate work in social work, they frequently work in agencies. They have to put in two or 3 days a week at an agency, field practice. And that's typically been unpaid. It's a struggle. If they have to have another job to pay their bills as well as that, it really makes it difficult. So this fund could be used to pay for field work, pay for the people that supervise them, or provide financial aid of some sort to keep them in school so that we don't lose that valuable resource of the trained social work professionals coming out the other end. That money can be spent over the next 3 years also. Starting in July, it'll be available, 20 million, and higher ed will administer that. We've asked higher ed to do 2 other studies and to come back to us with recommendations for this next session. One on what would it take, what would be the best way, let me put it that way, what would be the best way that they would advise us to try to make graduate behavioral health programs more accessible to students? Would it be free tuition the way we do with the Opportunity Scholarship? Would it be internships that they could repay with service after they graduate? They would stay here and repay it. Would it be a loan fund? Give us some ideas of what the best way would be to expand our existing capacity for training counselors and psychiatric nurses, psychologists, and social workers in this state. The second study we've asked them to undertake is to come back to us with a report on what would it take to expand what's already available in the community college and branch college network in the state, to expand the number of certificate programs in the fields that lead to peer counselors, community health workers, community, what do they call them? Certified peer counselors and community or social work aides, or all the varieties of different
peer social work.
Peer social work aides, yeah. All of those positions that are being trained in the branch and community colleges, and how do we get more of them going? What would be the best way of getting those going? Because those tend to be the feeder programs for the graduate programs later on, for the undergraduate and graduate programs. And I think in a lot of ways, those people coming out of those programs become the immediate workforce for a lot of our programs. They're the ones that get hired by a lot of local agencies to work for several years, building up experience, and then they go on to graduate education. So we'd like to expand that as well. Finally, we put another $10 million into higher ed for expanding the loan repayment fund as a way of attracting doctors and behavioral health professionals, not just for behavioral health, all medical professionals, but including behavioral health professionals into our communities. Right now, they're getting 10 times more applicants than they're able to fund each year. And so it's not as much of an incentive. I mean, basically what you're getting if you take a job with the promise that you could apply for a loan repayment, it's like a lottery ticket. Your name may get drawn, but you may not. And anything we can do to make that a much more likely event would be good. Next big area that we put a lot of money into is affordable housing. And I think we all recognize that one of the biggest barriers to people getting off of and staying off of addictions or dealing with the consequences of a serious mental illness, is the lack of housing. And if we could provide additional housing, particularly supportive housing with the wraparound kind of services, the navigation of the system that it takes, that would be really helpful. Senator Nancy Rodriguez has, I think, done a brilliant thing. She was able to get the legislature to agree that from here on out, every year, 3% of our bond issues, of our permanent land, what is it called? Of our the money that we invest in our bonds for capital outlay, 3% of it will go to affordable housing. That means about $40 to $50 million a year will be available for affordable housing programs in the state through the Affordable Housing Trust Fund. That then gets matched, and it's a fantastic match because tax credit financing gets matched with it, HUD monies get matched with it, local government monies get matched with it. That becomes an incredible resource, a leverage resource that could really make a difference for expanding. Now, again, one of the big barriers is manpower. We don't know if there are enough people out there who can build houses fast enough to spend that money, but it's going to be coming down the pike, and we ought to make full use of it to support our behavioral health initiatives in the county and in the state, in the city, county, and state. Then I want to mention crisis triage centers. We changed the law regarding crisis triage centers. It will now be possible, once the law goes into effect, I think later in June, for EMTs or police responding, or crisis response team members, to take somebody to a crisis triage center, even if they do not voluntarily want to go. If in the determination of the person making the response to this call is that this person needs to be seen by a professional, in the past they could take him to an emergency room, which was expensive. And as soon as they wanted to walk out, we had no way of keeping them there. This now means they can be held for an evaluation. They don't have, we can't hold them indefinitely. We can hold them just until the evaluation is completed at the Crisis Triage Center, but they would be able to be held there and hopefully long enough to get them hooked into some kind of ongoing treatment effort. Now, along those lines, one last thing I wanted to mention is the Supreme Court Commission on Competency and the courts. One of the big issues that we face, not just in the second judicial district, but everywhere in the state, are people get picked up for irritating or nuisance activities that are really, problems for the public. Urinating in somebody's yard, walking into a restaurant while people are eating and causing a scene, throwing a brick through a window, the kinds of things that happen all too often when people are going through a real breakdown or are under the influence of drugs. They get hauled into court. There's a competency hearing held. They're declared not competent to stand trial and they're released. And so it becomes a merry-go-round. Competency not being the equivalent of mentally ill or needing help. And so the Supreme Court Commission is struggling with that. We've got several other states who have struggled with this, have come up with some possible avenues that would be useful here. And so we're hoping that the Supreme Court makes recommendation for some legal change, some changes to our legal framework so that we might be able to hold people who are going through those crises, even if they're declared not competent, hold them not just until they're competent, in which case they'd come back and go to jail, but get them some treatment. And that's kind of the thing we're struggling with. How do you get treatment for people who need it, but who aren't asking for it? We have a hard enough time getting treatment for people who need it and are asking for it. The ones who aren't asking for it are an extra level of dilemma. Last thing I'll mention is, and this is by way of framework for everything else I've said, we're going, in my opinion, we're going through a terrible crisis in leadership in state government right now, just with the turnover in the departments. The Human Services Department, for example, right now has an acting secretary, an acting Medicaid director, an acting head of the Behavioral Health Services Division, and an acting head of the Behavioral Health Collaborative. 4 levels of administrative leadership that are just being filled, that really can't get new initiatives started. They're just trying to hold the place until somebody else can get hired. Something similar is going on at CYFD. At the health department, it's not the similar thing, but there is the issue there that the new secretary is from out of state. He's feeling his way, and there's a general concern there. In addition, we have the fact that we in the legislature, in our great wisdom, at the suggestion of the governor, have converted the Human Services Department into what's now called the Healthcare Authority. That starts July 1. None of us have any idea what that means. I will say that there is not a single legislator who could tell you with any clarity what that's going to mean, to have a health department and a health authority, and to have the welfare programs and the food stamp program in the health authority. So it's all playing out, but it adds an air of uncertainty to everything that's going on. And I may have missed some things, and if so, I apologize. If you have any questions and you still have time, I'd be glad to try to answer them. But thank you for inviting me in.
Thank you, Senator. I learned so much today. We have lots on the line, and I can't actually see folks. Oh, no, right now I can. Great. Yes, thank you, Senator. I have lots of questions, but these folks know I talk a lot, so I want to let them have the floor first if any other folks have questions. And thank you again. Okay, I do have some questions. Well, I'm very excited about it. Thank you for the thoughts around, I think I really appreciate your presentation that really brings everything in that housing is part of this, higher education, filling the provider gaps we have. This piece about the crisis triage center, I've been now, I think, for 2 years or over 2 years, like just going to every meeting, trying to learn everything I can. And one of the things I was hearing a lot from parents who are, have had children that were injured in their care when they were minors and had diagnosis for mental illnesses, and they were able to, as parents, be able to, when they needed, when they for whatever reason their medication was off or they weren't taking their medication or they had a outbreak that they learned to deal with, they could themselves as parents commit them so that they could get that kind of evaluation, hopefully get stabilized, and hopefully get continued care. And so many of those, the first 2 years of coming, I heard so many parents saying, like, now my son's 21 and I can't commit him. And the same thing that you explained happens. They come and get him and I want to help, and yet they're letting him out and we don't have or her or and they are still the care providers in many ways for those folks, even if they're living on their own or living on the streets. That they still are caring for them. They're still, and that this request, which is hard for me at first, right? Because we don't want to think about taking away people's rights to say, I don't want to be in, I don't want to be a mandatory treatment. But this ability to say for 72 hours, well, actually, when I went to Ohio and heard that in Ohio, they have a 72-hour available hold that they do this. Do you know how long the hold will be here, or you mentioned evaluation as being evaluation being the way you move forward?
Commissioner, I'm not sure if we put a specific time in. It was until the evaluation is completed. I'll have to go back and look at the legislation as it came out. Part of it was in regulation that the health department had, when we first passed the crisis triage legislation, the health department promulgated some rules. And it was in an attempt at modifying some of those rules that this year's legislation was passed. And I think that we didn't tamper with the number of hours, and I don't remember what those rules say, but it's 72 hours at most. I know that, and it may be that we don't specify exactly how many hours, but leave it up to however long it takes to do the evaluation and the assessment of this person.
Great, thank you. That yes, that makes complete sense to me, and I think that's just such a need that I wouldn't have known if I hadn't heard it directly from those families that are trying to support those loved ones. So thank you all for addressing that. I make sure I know and also the competency courts. I serve on Criminal Justice Coordinating Council as well, and we've heard this many times from the judges. So I'm just that this is a place where it's just getting missed. And again, it deals specifically with severe mentally ill, behavioral health needs, and how we can address that. So I guess I just mostly did want to thank for seeing that need and filling it.
Yeah. A few years ago, we passed we didn't call it mandatory outpatient treatment. We called it assisted outpatient treatment, AOT. And it made it possible. And I voted against it the first few years. The Civil Liberties Union was against it. What's it called? Jim Jackson and that group were against it. And then finally they modified it so that if you don't cooperate, you can't go to jail, which, in some ways took away the whole power, but at least it gave you a chance for the judge to use whatever effect his black robe would have on somebody, of ordering them to go into treatment. The problem is that we apparently, and so that was like 3 or 4 years ago we passed that, checked lately, and they're not using it very much because unless you have a memorandum of agreement or a memorandum of understanding with the local treatment provider, they can't really take them on that basis. So
Yes.
we may need to revisit that in terms of the legislation. It's kind of crazy to have that on the books if we're not able to utilize it. It seemed eventually like a pretty good idea, but
Well, it's back to your conversation about then there's not enough providers, facilities to.
mhm. Yeah, exactly.
I did have a question because I got to attend before the legislature started. I got to attend some of the state behavioral health, and Secretary Grace was still in place, and he said a lot about the priorities are providers and facilities, providers and facilities. Did as far as facilities go, do you know if there was? I mean, maybe that's in capital outlay.
It's in capital outlay, but there was, I should have mentioned this, 4 counties in eastern New Mexico had put together a proposal to create their own behavioral health facility. I think it's Roosevelt and DeBaca, Quay, and maybe Curry County. Anyhow, 4 of those counties out there in the plains, out there in the Llano Estacado, that agreed to cooperate, and I think they got 10 million. I know they got $10 million from the legislature for that project. So that'll be enough for them to start planning. They'll probably have to come back with a full-blown proposal. That is for a residential program. I mean, they're not talking about counseling. They're talking about a place where people could go and be treated in a residential setting for however long the program they developed takes. And we don't have much of that in this state. We really don't have much of that.
Yes. Thank you, Commissioner Olivas.
Thank you, Madam Chair. Thank you, Senator Ortiz-Pino, for your work and your presentation on this. So I had a question on the court order treatment diversion issue. You mentioned that there was lack of agreements in place to be able to use that tool. Are there even enough providers and beds to do that? What is LFC? What is the data showing? I mean, both statewide and locally. Do we have those beds and we're just not able to use them, or what's the landscape there?
It may have improved slightly, but last year during our hearings, the woman who at that time, now she's left also, Dr. Leah Harrison was the head of facilities for the state health department, all of their facilities, including Las Vegas, Turquoise Lodge, all of them. And she said that at that time, Turquoise Lodge was operating at 50% of their capacity. They were licensed for 40 beds. They had just slightly more than 20 of those beds occupied, and there was a waiting list, but they couldn't find staff to be able to open the other wing. The Behavioral Health Institute in Las Vegas, the state hospital, similarly had empty beds, but they didn't have staff, and so they couldn't admit people. Even Sequoia in Albuquerque, the facility for juveniles who have been declared delinquent, but who have serious emotional problems, they were operating for years, they were at full capacity, 32 beds. Last year, they were operating with fewer than 20 of those beds filled, and it was a question of staff. I think that the problems are linked. We'll see if they build it in eastern New Mexico. If they can staff it, that'll be really an interesting question. I think we've got to start at the bottom though and get more professionals in here. We've got to try to find ways. This reimbursement will help. Increased reimbursement through Medicaid. Increasing the salaries of state employees will help, because those are all state employees in those facilities. We got raises, I think 6 or 8% over the last couple of years, 2 increments. So it's starting to become a little less of a sacrifice for people to go to work in those institutions, but we just need to do so much more. We may need more physical facilities, but until we fill up the ones we have now, it's hard to make that case.
Thank you, Senator. Thank you, Commissioner Olivas. Any other questions for Senator? Well, thank you so much. Lots to chew on and learn about. And thank you for attendance.
Well, we'll probably have one of our interim committee meetings in Albuquerque. We'll meet on the 12th to set up our schedule. And, you know, it's always an open invitation to city councilors and county commissioners and school board members to come to those. If you have something you want to bring to our attention, that's a good venue to do it. So I'll try to keep you advised as to when we're going to meet in Albuquerque and where that'll be. Usually it's at one of the UNM facilities, but we'll find out and let you know.
Thank you.
Thanks a lot for inviting me.
Thank you and appreciate it, and have a safe and fun travels to Dixon.
Thank you. We'll see you soon.
Thank you. Thank you. We'll move to item, well, we're still on new business. We do have, we're deferring items 5B and 5C to the August meeting, and we'll proceed to item 5D, handle with care update, and Councilor Grout is here to introduce. Maybe.
Hello there, Madam Chair. Thank you for having me. I just wanted to give you an update. We were able to pass the resolution for handle with care. So it has been codified into our city law so that it will be standard operating procedures for all of our first responders. I'm very excited to be working with the county and APS for this to move forward. APS is going to be bringing their teachers back up to speed with this and get the ball rolling. So thank you all for your support. And I'm really excited that we're going to be helping these little kids, giving them a little extra support and love, and getting them the services that they might need.
Thank you, Councilor Grout.
You're welcome.
Looks like we have Dr. Christine Muir and company maybe to present.
So thank you, Madam Chair and members of the ABCGC plus APS Commission. I'm Chris Muir. I'm the Executive Director for the Student Family Community Supports Division with Albuquerque Public Schools. I also am here because I support our board members, but I wanted to just introduce Handle with Care quickly, and then I'm going to turn it over to Vicki Price, who's our Executive Director for Counseling, who knows way more about this program than I think anybody in the district or the city or the county. So she's going to share, we're going to share with you a little bit about the program. So does somebody have the PowerPoint?
Yes.
Share it.
So it should be loaded on the
laptop
right in front of you.
Oh,
It's
now I
probably,
have to do technology.
it's probably collapsed.
There it is. Look at that.
Yay. Great.
So we started this program before the pandemic, and it turned out to be really useful for students. And then the pandemic hit. And of course, we didn't need it during the pandemic because everything was virtual at that time. Classes were virtual, students were home. So it sort of went to the wayside, but we're really very, very excited of bringing this program back. We were approached to bring this program back, and we're going to be moving forward with this and have a great partnership with both the city and the county to make this happen. And so I'm going to turn it over to Vicki Price, who will talk to you more about what the program actually is.
Thank you, Dr. Muir. Thank you to members of ABGC and APS plus APS for having us here tonight. This is a program that we're really proud of, and I do want to, from the bottom of my heart, thank Commissioner Grout for coming and helping us revive it, because it needed to be revived. It's an important program. So before I get into the crux of the program, what I want you to just picture that first responders get called to a house. There's a traumatic event. It's in the evening. It's late, 10, 11, 12 o'clock at night. There's things going on. They have to secure the scene, and there's kids around. And they're young, and they're impacted. They're tired. They're crying, probably hungry, and it's not a good scene. Our first responders take very good care of these kids. They get the scene secured, tuck them into bed, and then they get up for school the next day. So what the first responders get to do now is send us a notification saying, hey, we have these kids, we're worried about them, and we want you to check in on them tomorrow. So that's really what this program is about, this soft handoff from the first responders after they've lovingly cared for these kids at the scene, and now they're handing them off to us for us to lovingly care for them as well. So Handle with Care is really just a notification system between the first responders and APS. It's a very simple thing. They have the student's name and they pass it on to us. If they know the school, that's great. If they know their age, that's great. If they just know their name, that's okay. They don't tell us any details about the event. They just say, here's a Handle with Care. Take good care of them tomorrow. So they send the Handle with Care to us. And then we know we need to have a response. And, regardless of whatever the source of trauma is, and at that point, we're not, we don't care. We just know kids need taken care of. And we know when kids are exposed to trauma, early intervention, early recovery, early people intervening and wrapping their hands around these children is essential. So Handle with Care is the notification that provides the school with a heads up when a child has been identified at the scene of a traumatic event. Police are trained to identify children, all first responders, not just police, but they're trained to send us a confidential email saying, hey, Handle with Care. And it goes through our APS police department, and then they take care of notifying which schools. So they figure out, and if there's multiple kids at the scene, they will notify multiple schools if that's necessary. If they don't know the school, they search, they'll find them. And we've had pretty good luck being able to, with very little information, find the kids and make sure that we're taking good care of them. When the school receives a Handle with Care notification, it's going to go to 3 people. It's going to go to the principal, the school counselor, and the nurse. And one of those people are going to receive that email in the morning. They're going to respond back to the group and say, I got this one. I'll take care of it. And so it's very simple emails that go to people. Then whichever one, the teacher, the principal, the nurse, or the counselor that receives a notification is going to talk to other adults that are going to be interacting with these students that day. Say, hey, we have a Handle with Care, eyes on. Let's make sure we're taking really good care of these students. We do not question the kids about the event. We do not ask them about it. It's not a call to action. It's a call to have eyes on the student until we need to provide action if it's needed. So what we're going to do is we're going to monitor the kids' behavior. We're going to watch, do they seem tired? Are they hungry? Are they just distraught? Or are they doing fine? Some kids experience some of these things so often they're not highly impacted. Unfortunately, they become very resilient. So we're not going to call them out. We're not going to say, hey, we know something happened at your house. What's going on? We're just going to have eyes on. But they're sleepy. They're tired. Maybe we postpone a test that day. Maybe we make sure that we don't give them a hard time if they don't have their homework done that day. Hey, how about a pass today? Or if they do seem like they're having an emotional response and they need support, of course, then they're going to be referred to their school counselor, who then will meet with them. But they'll talk to them about where they are. They're still not going to ask them about the event. They're going to say, how you doing? You seem a little sad. You seem a little tired. Something I can help with. Most of the time, the kids tell us, if they haven't already. Sometimes they come into school and go straight to their counselor's office or the nurse's office right away, which is great. But this gives us a way to know the kids that are staying under the radar, and now it puts them on our radar. So, as I'm explaining, this is not necessarily a call to action and a way that we're going to intervene if the student doesn't want that kind of intervention. But again, we're going to provide a soft, loving environment for them. We're going to give them a snack if they want a snack. We're going to let them sleep in the nurse's office if they need to sleep. We're going to let them talk to the counselor. Maybe they just need a quiet place to do their schoolwork that day. Whatever it is, maybe they've showed up with no supplies that day. We can provide all of that. It also allows us to now have the student on our radar so that we know when they come in the future, if they want to talk to their school counselor, or they're in the nurse's office often with a stomach ache, we have this bit of information that just helps us provide, you know, a soft landing, a soft place to be, and basically just a way that we can handle them with care from there forward. So that's basically the crux of the program. I hope I've described it. It's very simple in how the notifications happen. It's not evasive. We're not violating anybody's right to privacy. It is a supportive and helpful way. The first year that we rolled it out, and it was kind of a slow start. We had over 1,000 notifications that year. So, those were 1,000 kids that we got to watch and look at and lift up if they needed it. And I don't.
So the other thing that Ms. Price didn't say is that we also, sometimes the kids don't show up the next day, but we get the handle with care. So that gives us a heads up. And because we know that it's not just the child that's in trauma, probably the whole family is, we're a lot more lenient about, parent didn't call in, that type of thing. So we know that something happened, and we will then continue the handle with care when the student does show up. And this is a K-12 program, so it's not just for elementary school kids, it's not just for middle school, it is K-12. So it's eyes on, making sure that we know that this student may need a little bit extra care. So we're very excited about getting this program restarted, and we're getting ready and geared up to train the people in our schools on what they need to do. And I know that the city and the county are getting ready to train the first responders. So we're all going to be on the same page when school doors open a little bit earlier next year. So we're going to be ready, hopefully, to hit the ground running with this program. And we will stand for questions.
Thank you so much, both Dr. Muir and for the presentation. Yes, anyone have any comments, questions? Councilor Grau, you have anything to? Oh, yes. Ms. Danielle Gonzalez, please.
Great. Thank you, Madam Chair, and thank you, Dr. Muir and Price, for the presentation. I have two questions. I think one is probably for the APS team, and one is perhaps for Councilor Grau or someone else, maybe. The first one for APS is just a question on data collection and analysis. And so the last part of your comment, you mentioned previously there were 1,000 or so handle with care incidents. I'm just curious, what's the data collection process that's in place to assess how many of these are coming in, what trends exist, is the response happening, how do we know that this is working?
Thank you for the question, and I kind of expected it from you. So, so the data really is more of just how many we get and who we're getting them from. So, and that's done through our school police. So the call comes in, the email comes in to a confidential email that's set up between us and the first responders, and we log all that in. The rest of the responses, if there is something that happens that so the child needs to go to the nurse's office because they're just too tired and they need to rest, those types of things, those are all logged in either the nurse's office, the counseling office. Otherwise, it's just we know that it happened. One thing of the trends that we did see, and so I'm really glad that we've been presenting to the different city counseling, city and Bernalillo County groups, because we did notice that there were trends on the responders that we were actually getting emails from. And so we're very hopeful that this year all the first responders are going to be on board, and that we'll have the support that we need. If we're seeing, we're getting a lot from, I'm just making stuff up, from the fire department, but we're not getting any from APD. Is there a reason? And so having the people that oversee those departments to find out if there's something that we can do to help them feel more comfortable with it, make sure they understand what the process is, because this really is something that happens. And what I think, we'll, because we only had it 1 year and then the pandemic hit, one thing that we're planning to do for the future is to, at the end of the school year, to look at that data, go back and look at the students, because it's really about, this is about the students. It's not about anything else. And did it, we're not going to interview them or ask them that, but did they stay in school? Did they continue to do well in their classes? Did they need any further interventions? Were they referred to health and wellness teams? We didn't do that for the first year because we had the first year and then the pandemic hit. But we are going to be looking at that data for the future.
Great, thank you. That's very helpful. And then my second question is just sort of acknowledging that this is a partnership between first responders and Albuquerque Public Schools, but in our broader, both Albuquerque City and Bernalillo County population, a significant and growing population proportion of our kids are actually not attending Albuquerque Public Schools, many in other local education agencies, charters, and others. Is there anything in the works or any options to sort of help facilitate handle with care processes for some of these other LEAs as well?
Well, one thing that will help is we actually have a video on the training. This is not a program that was developed at APS. This came from West Virginia, and so we actually borrowed their program, but we did our own video, and we're hoping that we can update it because the video information didn't change, but the people have. So it was a couple of superintendents ago when, but they're on the video. But so we have a video. We have actually shared that with other communities. There is I believe, a group that is together nationally that's looking at this program, but I think West Virginia is really sort of the lead for that. But we are more than willing to work with any LEA in the state or the nation if they want to call us. But the video is really good in terms of understanding what the program is, and it's a short video, and it will be on our website once we get it updated in our intranet. But we will share that with other LEAs. We're more than willing to do that, to present to school boards, that type of thing, because it is a good program, and it doesn't take a whole lot, and it doesn't cost anything. It just means you have to be organized. It's a little bit easier for APS than some of the other districts because we do have a school police department. So there is a central place for those calls to come in, and for them, then they do all of the research to figure out what school the kid's in. So the child may not tell the first responder what school they go to. That's all we need is a name. We'll find out, and we'll get it by the morning, and they'll have that email going. So, but there's ways to do it even without having a school police department.
Thank you. Any other questions from any of our members?
Madam Chair.
Yes, Councilor Grau, and then Commissioner Olivas.
Thank you. We have reached out to a couple of the representatives, our state representatives. So they're looking at that to see if we can take this to the state level and, maybe perhaps go statewide just to help because we know that there's, kids outside of the Bernalillo County and the city. We know that there are issues going on too. So just the bottom line is trying to help our kids and make sure that they are receive the care that they need when they need it. Thank you.
Thank you. Commissioner Olivas.
Thank you, Madam Chair, and thank you, Councilor Grout, for your leadership on this and bringing this important issue to the fore and educating all of us on what this is, how it works, and where it's been and where it's going. So I really do appreciate it, and I think it's so important, and it's a great thing. Wish we didn't have to do it, of course, but it's something we need to have in place. So I guess my and a big thank you to the folks at APS too that are making this happen, because that's the key link in all of this. I guess my question is just I know this program was originally rolled out several years back. I think it was Commissioner Hart Stebbins that had done a lot of work on this. That's probably what you're talking about, the old video and that kind of thing. I think I've seen that. It was forwarded to me by, I think it might have been by her. But so during that time, between now and then, this was still happening, but I guess what you're saying is just the training wasn't widespread. There wasn't really a consistency behind it, or sort of where have we been in the intervening years since this was first rolled out? And why is it different now?
So I wouldn't say the training wasn't widespread. I think that the buy-in wasn't widespread from some of the first responders. They really didn't know what the program was. I think that, we had a meeting with Commissioner Grout to set it up, and the first responders are very much on board. We didn't have that. When we first did it, there was a lot of hesitancy on what does that mean? Am I giving you information that I can't give you? We had to involve a lot of different lawyers from the different groups to look at it, to make sure that this was not something that was going to break confidence and do those kinds of things. But I would say the feeling and just the excitement is across the board this year. In that meeting that we had, all of the first responders are on board. They really want to do this. Actually, some of them jumped the gun and sent out the resolutions too soon because we were like, we're not ready yet. But to begin, they wanted to just start it right that day because we got to go back and train people, and they have to train people and do that. But I think they're ready to go. And I don't foresee that we're going to have the same issues that we had when we first did it. It was a new program, but now that we've done it and they go, oh, okay, that's all it really is letting you know, eyes on this kid. And that's really all it is. That's absolutely all the program says. They don't tell us anything. They just give us a name. If they can give us a little more information to make it easier to find the kid. One of the things when we talked about spreading it, sometimes, obviously, there are other schools in Albuquerque other than just Albuquerque Public Schools. And so we're not asking first responders to find out, does this kid go to a charter school? Do they go to, but, one of the things that after we get it rolling up again, that we might want to consider, and I just thought of this as the question was asked, is to bring in the charters and say, because we do get charter kids, and then we realize, oh, this is a charter school. Well, they are not part of the program, so they haven't been trained. And so it could be a private school student. It could be one of those. So to bring in the other schools in Albuquerque and say, are you interested in this program? If we get a student that we realize goes to your school, would you be willing to also keep eyes on this child at your school? So, and we could provide the training for them to do that. But that was a few things that happened in the first year. It was like, oh, this kid goes to charter school. What do I do with them? They haven't been trained. So, what we were doing is like just contacting the principal of the school and letting them know you've got a student that had a traumatic incident. You might want to keep eyes on them. But that was all we could really do. And you can speak to that too.
There already have been several school districts that are reaching out and questioning and wanting to know more about it. So, that is an in-kind service that APS is always willing to do. As the largest school district, we feel an obligation to assist other school districts. Rio Rancho has shown interest, and so that's something my staff and I are willing to do, to go out and do in-kind trainings, to provide the video to anybody that wants it. So we're committed to helping it grow in the state as well as work in Albuquerque Public Schools.
Thank you. Is there any other questions? I just like to say, I think this is super important. Thank you. I think you all are thinking of the things that, you've already thought of a lot of things, confidentiality, and things like that in the schools is always a thing. And I know you all have to handle it, and we'll think of that securely. I always have a story. So my story for this is that when my son went into middle school, I I was a single mom, and I really foundationally said nonviolence is from the time they were babies. And when he went to middle school, a kid came up to him in gym class, just straight to him, and just tried to start fighting him. And he wouldn't fight him. He wouldn't fight him. He finally he walked away at some point. And of course, his friends and ongoers said he just didn't want to fight. He was scared or whatever. And so whatever the reason, he didn't fight him. That kid came to him 2 weeks later and said, "Hey, man, thank you, because that night I had just lost my mom. Me and my sister had been pulled out of my mom's and told we were going to be separated. Pulled away from my mom until we were separated." And so that's just the thing, is often like you're noting behaviors. That's what they're looking for, right? Something to get out of here or replace whatever heck is going on with me. And so I just really think this is good, and that it's not invasive. It's not like hovering over, but just keeping an eye for those. If that kid had gotten in a fight, he probably would have then got suspended, and it would have escalated from there.
Right.
But this would give the warning that, like, hey, give that kid a little break because he's going through some stuff. So, thanks. Thank you.
Thanks for sharing that story. That's great. That's the whole reason the program's here. Yes.
And my son and that kid and his family are still close and friends. So
Awesome.
I know it's this beautiful little story. Thank you, Counselor Grout, for your leadership. And the last thing I was thinking is that like a hotline or something, maybe for future, maybe it's through text, or I just feel like there's new innovative ways to communicate, and emails. Like, I think that would help it spread faster, but just a thought.
Yeah, thank you.
Great. Okay, thank you for that great update. We'll move on to item number 6, old business. We got our good old regulars. Ms. Pam Acosta, Senior Manager Pam Acosta, and Mr. Barndollar on our continuing behavioral health initiative updates.
Yes, thank you. Good evening, Madam Chair Barboa, Vice Chair Fuelcorn, and members of the commission. I have 5 updates for you on BHI and what we've been up to. The small provider grant RFP was released on April 30th. The RFP for the small provider grant is open for submissions until July 7th. And the grant is for up to $2 million for small behavioral health providers operating on a budget less than $500,000 who are seeking startup and capital funds. The RFP can be found on the Burnco Bonfire Hub. So if you happen to talk to your constituents, let them know. We did change add some additional commodity codes to expand the pool of submissions. We have had some interest. We're hoping to get more applicants that are interested. Currently, addiction services, human services, senior and youth services, suicide prevention, and we just wanted to expand that commodity list. The second update is the RFP for school-based mobile health clinics was released on May 14th. We're actually working with Dr. Muir and Ms. Vicki Price on that. It was released on the 14th, and those submissions will be accepted until July 28th. We're looking for proposals to provide primary and preventative health care services in the school and in the community. There's 2 units that are under construction, and they should be ready by early September. And 1 or 2 service providers will be awarded up to $800,000 recurring annually. I've been working with Dr. Muir and Ms. Price to discuss the 4 quadrants of how the school-based mobile health clinics will be assigned. And we're looking at data to look at schools and where it's needed, have those conversations. And then also 2 charter schools and community centers in the off months. So I wanted to let you know a quick update on the Tiny Homes Village. We had a mural dedication that took place on May 3rd. That was a success. The villagers of the Tiny Home Village made thank you cards to the artist, what the art meant to them, and how it's improving the atmosphere of the Tiny Home Village. We have had a lot of success. We thought we would be full to capacity, but the program is working as it should as a transitional living model. The program is an 18 to 24 month, and we're finding that a lot of individuals are moving out quicker into permanent housing. So from February until April, we had 13 move outs and 13 move ins. So what would have been reaching full capacity, we're placing people into permanent housing. 7 individuals actually got placed into permanent housing. And if you take that 7 and divide it by the 20 homes that we were averaging of where we were at, we're looking at a 37% placement rate into permanent housing, which it's our understanding is really significant for this model. We have some new partnerships. We had NMSU who came in and provided ICANN classes, nutrition classes. So the villagers completed those courses. And then we have a partnership with Albuquerque Center for Hope and Recovery, who are coming in and also providing some groups. They're one of our providers up at the Tijeras Living Group model. And so we've been utilizing that center to transport the clients up there once a week so they can attend groups. It's an outing, and it's a change of environment for them. Let's see. The challenges that we've been having there are pretty much common with everyone else. The competitive wages, competitive jobs in this field, something that Senator Ortiz-Pino mentioned on, just finding good individuals. The other challenge has been it's a 24/7 operation, and some folks just don't want to work swing shift or graveyards, and that's where we need them. And then the fourth update that I have for you is the Board of County Commissioners and our Budget Department approved to hire a deputy county manager to oversee the behavioral health system within Bernalillo County, so BHI and the Department of Behavioral Health Services. And they also approved to hire 2 data analysts, which we're super excited about, can start analyzing the outcomes and output that we're collecting with our providers and our funding, our funding opportunities. And then lastly, this week, $580,000 was approved for medication-assisted treatment at MDC to expand the pilot program, keep it ongoing, and to sustain us until December. And we'll be using opioid settlement funds for that. And I stand for any questions, and I also am accompanied by Michael Barndollar, who is our chair of our housing subcommittee and our vice chair of our steering committee. So,
Any questions for Senior? I think we'll get to you, Commissioner Olivas.
Thank you, Madam Chair, and thank you, Senior Manager Acosta, for your update and your work on all of these initiatives. And I really just wanted to call out the Tiny Home Village as what I think is really I'm really thinking and hoping this is a budding success for us here in Bernalillo County, city of Albuquerque. I had the opportunity to tour the village when I attended the public art ceremony unveiling, and really it was, I think we have something special going on there. I really do. I think there's a sense of community developing there. It's very clear. It's a very high quality facility. It's something that I think has the real potential, as we're already seeing with the number of people that are cycling through there, which is exactly what we want. Cycling through to placement, not cycling through back to the streets or back to, unsafe conditions, but cycling through to better places. And for example, I was at Popejoy, about a month ago or so, and got approached by a gentleman that was with some of our villagers, one of our staff from Bernalillo County that works at the village there, taking them out to that. Just really good things, building community, building them into the community or back into the community in a healthy, productive way. I just think it's something that obviously has not been without its share of critics and its share of significant, delays and hiccups and problems. But I think it's really clear that through the work of Ms. Acosta and so many other people that work there, that there's good things happening there. And so I just want to say great work to our staff, to the community that stood behind that project. I think we're really on the precipice of in a couple of years coming back to that and saying, wow, that was a really good move. And I know there've been some others in the community and on the county commission at least that have said, well, maybe we should privatize it or sell it. Or I think we're doing the exact right thing at the right time here with that. And I think we just need to stay the course. And I think that we're already seeing it pay dividends. So great work to our staff and on your other initiatives. You know, those are a little earlier on in some cases, but I'm excited about the deputy county manager. I think that that's, you know, only going to be another thing that takes us from good to great, along with the data analysts and so many of these other things, the school-based mobile health centers, lots of good things in the pipeline and more to come. So thank you, Ms. Acosta.
Thank you, Commissioner. I appreciate that very much.
Anyone else? I did, Pam, when you were saying that thank you again, I'm excited about the 2 million for small providers or small budget providers. You said that you added commodity
Codes to expand who can apply for the RFP grant.
Can you name those again? I think I've seen.
Yeah, I just jotted down a few of them, but mental health services, addiction services, human services, senior and youth services, suicide prevention, and those are just to mention a few. I believe they also added health centers as well, if I'm recalling off of memory. And of course, these are broken up in very specific codes. I just lumped them together just to give you an idea of, we're just trying to widen it as much as we can. We really want to support our small providers, get them started. If they've started something great, we want to enhance what they're doing. You know, a lot of times our funding will go to established or providers that are larger, and we really want to support those small providers so that we have more options.
Excellent. And so $2 million isn't a lot of money. Do you have an expected range of how much each grant would be, or?
We don't. Thankfully, we haven't established a floor or a ceiling of how people would be awarded. I think that would be during the RFP process and the ask of the provider.
Okay. All right.
Madam Chair, I also wanted to add, thank you, Michael, for reminding me. If all goes right, tomorrow our application window will open for tiny homes for 1 week. We had a few glitches, and then we had to correct some of the language when you click the application link. But if all goes right, it should open tomorrow. If it doesn't open tomorrow, it'll open Monday, and it'll be open until the following Monday. So we're hoping with that, in addition to the placements, that we're able to get more people in, get ourselves as close to capacity as we can, and then start the process all over again.
And then with that, thank you. That's great information. I'm glad we're opening up again. Is there still paper applications available?
Yes, and we actually, the window of our application opened up inadvertently for 1 hour when we were testing the system. Within that 1 hour, we received at least 10 new applications. Some were emailed to us, and actually, I think 5 people came, 10 were emailed and 5 actually came in person. So they're hand delivered. So they are paper applications and scanned versions.
Okay, great.
And if there is anybody, and just so you can let your constituents know, if there is anyone who does have issues with reading or writing, they can reach out to us and we'll help them manually fill it out. We want to make sure that everybody's included in this.
And you providers know that it's open. I mean, that's probably where you're getting the 1 hour flush of.
I think so. We're not really sure because we hadn't announced it, but we will announce it. We'll reach out to all of our providers, and then I believe that we're going to work with communications also to put out a social media release as well.
Awesome. Thank you.
Yeah, thank you. Appreciate it.
Yeah, Mr. Barndall. We'll call this the opportunity for subcommittees to address the question.
Opportunity for subcommittees, and I am the subcommittee tonight.
Yay.
So Chair Barboa, Vice Chair Vivocorn, and members of the commission, I'm Michael Barndaller. As Senior Manager Acosta said, I am the chair of the Supportive Housing Subcommittee of the BHI and the Vice Chair of the Steering Committee. She stole all my thunder, but that too, I'll get to that. So Ms. Acosta stole all my thunder about Tiny Home Village. I was going to, give them a lot of credit for all the work they're doing. It is a committee that our housing subcommittee really monitors that because, as Commissioner Olivas said, some of the controversy over the tiny home village in the past and in our last meeting, we got a very, very in-depth report from not only Senior Manager Acosta, but Stephen Brooks, who formerly with BHI now manages Tiny Home Village, and an incredibly in-depth report. And I have to say unanimously, the Supportive Housing Subcommittee feels that we're absolutely on the right track and very proud of the work that's going on. Another responsibility of our subcommittee is to look at the housing continuum for people who are homeless, precariously housed, suffering behavioral health issues, mental health issues, et cetera. The continuum lists all forms of housing from like emergency overnight shelter all the way through residential treatment, permanent supportive housing, group homes for people with severe mental illness. And we're attaching to that the various kinds of populations that need that housing. We're attaching to it the types of housing it might be. For instance, is it HUD supported? Is it housing first model, a sober living model? So we're creating this continuum so we can truly look at the gaps in housing services and then start to fill them. It allows not only the behavioral health initiative, but we're also working with the city, so the city to also look at where the gaps are really needed. We can collaborate at a much deeper level between the city and the county in filling those gaps. So I wanted to mention that that's something that's really critical as we move forward. And at some point, if you all want to see what that continuum looks like, I'd be happy to share it with you. It's getting even more robust as we fill in the blanks. Speaking of the city and the county working together, we have a behavioral health initiative working group, of which Senior Manager Acosta and I are both proud members. So for those of you who are members of the County Commission, sneak preview. I know you don't expect this at all, but housing is going to be one of the recommendations we're going to be talking about when we meet on June 7th. Family and Community Services Deputy Director Gilbert Ramirez is a phenomenal member of the working group, and we don't have assigned seats, but Mr. Ramirez and I wind up sitting next to each other probably at every meeting. And so we're doing some great collaboration right there. But it's allowed us to get a better understanding, and I think you'll see this in the recommendations that come out of the working group, a better understanding of how the city and county can collaborate together, even up to including talking about joint funding, joint monitoring, those kinds of things. So that's pretty exciting. The last thing I want to mention, I did have it in my remarks, but Senator Ortiz-Pino just allowed me to take it a step further. I'm privileged to serve on the Supreme Court Commission of Mental Health and Competency with the senator and many other folks that are from around the state. And he talked about the issue of assisted outpatient treatment. So I would like to address a little bit of that and answer Commissioner Olivas' question by supplementing something that the senator said. So one of the real problems that we have, a person is arrested for a misdemeanor, they go to court, competency is raised. Statute of New Mexico states that if an assessment is done and the judge agrees that the person is not competent to stand trial, and competency in New Mexico is two things only. You understand why you're there and you can assist in your defense. If you don't meet that criteria, the court has no choice but to drop the charges and release you. If the person is homeless, which many are when they commit this misdemeanor, they're back on the street. We need housing for those people desperately, even when a competency evaluation is ordered, even when assisted outpatient treatment is suggested, which of course, as the senator said, the court has no leverage to make that happen. The person can disappear because they're homeless. So let's say, and we've got a real backlog on competency evaluation, so let's say we've got one coming, a person's got one coming up, but the people who are doing it, contract people who do those evaluations can't even find the individual. We need housing desperately for these folks. And I want you to know that we've already had conversations starting the Behavioral Health Initiative, and with the county manager on programs that might work for that. And the other, so to also then address Commissioner Olivas' question, one of the reasons that assisted outpatient treatment isn't working, it's outpatient treatment. So because the court has no leverage, and the fact that these people go back on the street and they disappear, the judges say, what's the point? So one of the reasons that it's not utilized to the great extent that it can be, and we do fund it, by the way. The county does fund AOT. One of the contracts I can think of is HopeWorks. So it's out there, but until the court has some leverage to basically mandate that an individual get this treatment, and has folks in the court who are case managers or forensic navigators who can make it actually work, then it's still going to be a period of time before AOT becomes really effective. But housing is a real critical key. So you'll see that too as we work through the working group stuff and bring all of that to everybody's attention. So that's all I have to say. I stand for any questions.
Any questions? Yes, Commissioner Olivas.
Thank you, Mr. Barndollar. Always enjoy hearing from you, and so grateful for the work that you and so many others are doing on that behavioral health work group. A couple of things I wanted to say about that. This is just a comment, but since we have a couple of counselors in the room, I just wanted to say, I know that the work group is going to be presenting to the commission on the 7th. We've got a special working meeting to talk about those recommendations, and just wanted to drop the suggestion that, maybe that's something that the city council ought to pick up and have a presentation, have a work session, whatever it may be, but just something to think about, because if we are truly going to get to a coordinated system, I realize this was a work group that was set up by the commission, and the original iteration of it was to really look internally at our behavioral health system and our initiative and how we can do better. But inevitably, it means everybody getting together and collaborating, cooperating, working together. So I just wanted to throw that out there for folks to think about, and how that might work, how that might look at the city and APS for that matter. We have APS representation involved in that group as well. So I think it's something that's relevant to all governmental entities. So Mr. Barndollar, the thing I just wanted to ask you a question on, I think you gave an answer, but I just wasn't quite sure on the assisted outpatient treatment. What you're saying would really help that work is having, I think, two things: having housing that's dedicated for folks that are in that situation of, having a misdemeanor, having some kind of court interaction, criminal justice interaction, but need housing so that they have a more stable situation. And B is having navigators, whether those are caseworkers, social workers, whatever, in the courts that are working with those particular clients to probably link them up with that housing that does not exist, but hopefully will, and link them up with those programs like the HopeWorks program you mentioned, or perhaps other programs that are out there or need to be out there. And then, so I think that's what you said the answer to that was. Is that better than more of a inpatient model, or why should we do one or the other? We probably need both. I mean, I'm sure there's different cases, different severity levels for different people, but I know that a sort of a court-ordered residential treatment model is probably a model that's going to have more teeth, as you say, to have leverage over individuals to participate.
Chair Barbour, Commissioner Olivas, the whole model, the assisted outpatient treatment model, is really based on outpatient and not residential. And it really has to do a lot with the most non-restrictive site or available site for the individual to receive the treatment. And if we did have enough beds, perhaps the judge, and we had the ability, the court had leverage, perhaps there would be more opportunities for inpatient treatment. But the model really is based on outpatient treatment rather than being residential. So I hope that answers your question.
It does. I think so. Thank you. Looking forward to that.
Thank you.
That working group report.
I think to that point, because a lot of these are misdemeanors that aren't like related to their or aren't directly related to their mental health and their competency, right? Like if somebody stole a candy bar, I don't know, that's not gonna, but that's where they need to be filled with, but they can't still, that's what it is, that they can't come to, and they're not competent to go to trial, right, for themselves.
Yes, Chair Barbeau, that's correct. So, these are the folks that we see on the street in Albuquerque all the time. And they're the kinds of folks, unfortunately, that the general public that doesn't understand mental illness, substance use disorders are frightened of. I mean, this is really an economic development issue as much as anything, getting these folks off the street. So, they sleep in somebody's doorway, that's trespassing. They have to have a place to go to the bathroom, they pee in public, that's against the law as well. So they get arrested and it's really a misdemeanor. And they're doing that because they're homeless. And they go to court and it's usually the public defender that raises the issue of competency. It's about 90 or 95% of the cases. The public defender says, this person really isn't competent to stand trial, meets the criteria. The court has no leverage other than suggesting treatment. If the person is there, there is the ability, but it's for a short-term civil commitment, but it's really difficult. Once we have the crisis triage center in place and people can wind up there as well, then so a person could go from the court where they're not competent to the crisis triage center. Now we've got a different picture in place because now they can be held and actually have a more formal evaluation. So the pieces of the system are coming together, but they're not all there yet.
Thank you. Any other questions for Mr. Barndaller? Well, great. Always a pleasure. Thank you.
Mine as well. Thank you.
All right. The item number 7 or 8, announcement of the APS Albuquerque Bernalillo County Government Commission plus APS. The next meeting is Thursday, August 24th, 2023, ABCGC plus ABC, 5 p.m. here, Ken Sanchez Chambers. If there's no other business, this meeting is adjourned. Thank you all. I don't know, I stumbled through